Hey everybody, it's David Kemp, host of your Highway to Health podcast series. And thanks for joining us. I know if you've listened to the show in the past, we're passionate about articulating, defining this open road journey that we're all on in healthcare. And the end goal is to improve access, experience, and outcomes for our patient community. And we know it's going to take a village to do that successfully. There's plenty of challenges, and we can't do it ourselves. And so we've looked at the provider side of things. We've looked at digital health solutions and innovative software solutions to help those providers do their job. We've talked to patients and discussed the patient responsibility, gaining the education they need, being responsible with their behaviors, and paying attention to the things around them for mental and physical well-being and what they can control. Today, I'm excited because we get the payer side of things, and we get to talk to one of the most respected people in the industry about what the payer is doing to be an ally to the rest of the village and to bridge those gaps that are current today and have been traditionally something that we've looked at in healthcare. And we'll take a look into the future down the road a little bit to see where we go from here. So with that, I'm excited to introduce, the regional vice president, medical director of strategic accounts at Anthem, Dr. Sam. Dr. Sam, welcome to Highway to Health.
Thank you so much, David. And it's such a pleasure to be on your podcast. We've heard so many great things about it. And so as soon as I was invited, I jumped at the opportunity to join you and all of your listeners today. So this is going to be exciting, and I'm really looking forward to a great conversation.
Well, I'm honored to have you here. And, we, in the preview, we talk, what we're going to talk about today, but, here's something that I've asked a lot of executives over the last 2 years during this podcast. And I'd like to get an inside look at Dr. Sam. So we're in healthcare, right? We understand that taking care of ourselves is important. With how busy you are and how tight your schedule is, I'd like to ask our executives, what healthy habits have you built into your routine to help you stay physically, mentally strong, aware, capable, and present, not just professionally, but personally as well? What healthy habits have you built into your routine?
Great question, David. I think like many of us, when we're earlier on in our lives, in our 20s, we don't know a lot about nutrition. We don't know a lot about physical fitness. And I never wanted to be one of those physicians that doesn't practice what they preach, right? So when you go to your physician's office, they talk to you about eating healthy and exercising. Last year, I read a book called Younger Next Year. And for those of you who haven't read it, it's a New York Times bestseller. It's written by an attorney and a physician who happen to be bodybuilders. And what they learned is that they really were trying to get to the fundamental causes of aging, what makes people age and what could potentially reverse that aging process. And without giving too much of a spoiler away about the book, the take-home message is that they found that when people lift weights, they do some sort of strength training as part of their exercise, whatever type of exercise regimen they're involved with. There's something about that muscle breakdown and healing process that's anti-aging. And at a chemical level in the body, they found that weightlifting actually reverses the aging process in a really significant and quantifiable way. So one of the things I did was, as I got older, instead of just doing cardio and things like that, I started lifting much, much more heavy weight safely, nothing beyond like what my body could tolerate, but I push it every single time I'm in the gym. And so I actually feel physically stronger than I've ever felt before because of that weightlifting. I don't ignore cardio. I definitely have cut out a lot of junk foods from my diet. I never drink soda. I don't smoke cigarettes or tobacco of any kind. Alcohol in moderation, really.
Yeah.
But those are the healthy things that I like to do. And I'll tell you, I actually, I have a lot of colleagues that are very into physical fitness as well, and we travel a lot as part of our work.
Yep.
They taught me some things you could do, like push-ups and things like that. So on a daily basis, I try to do 50 to 100 push-ups wherever I am if I can't get to the gym. So those are just some things I like to do. But everybody has their own regimen. I think that the key is to just keep moving. Don't ever stop moving.
I agree. You got to move your body. And, that's what we're made to do. And
That's right.
and so I agree with you. You a morning guy? You a lunch workout? You an afternoon, evening?
I'm a morning guy. I have two daughters, and what I like to do is when I drop off my older daughter's school, I'm already halfway to the gym, so I just head there. It's not unusual to see me in a Under Armour sweatshirt or something if my first meeting of the day, and just fit in a shower there before the rest of my meetings start for the rest of the day. So I am an early riser, compulsive list maker. That's kind of my personality.
Yeah, I'm not a morning person, but what I've learned is if I don't get a lift in the morning, day gets away from me, and I end up pushing it to tomorrow. And so I've got to get it in the morning too. And I actually had recently on the podcast the medical director, the director of player health of the Milwaukee Brewers, and we were talking about weightlifting and young adults and adolescents and when the right time is to develop good habits and a good routine. And I love the way he defined it. He talked about how just like school introduces mental challenges and problems to the brain that you have to work through to become smarter, more resilient intellectually, lifting weights is the same for your physical well-being. And by introducing weightlifting or plyometrics or these different type of physical activities and challenges, what you're really doing is introducing a problem to your body that it has to coordinate and solve for itself. And I loved the way he explained that. And I don't know if my kids, like my boys and my girls here at the house, uh, love how excited I am about introducing them to some of these things, but I thought it was pretty informational, and I think we can all learn from it. So
Yeah, I like that comparison. It makes sense, right? I mean, you have to use your body, you have to use your mind, and in doing so, the human body is the only thing that gets more beautiful the more you use it, right?
very
So, somebody said that to me once. I was like, wow, that's very insightful, and that's true. I have an 83-year-old father-in-law who, my wife is Italian, her parents come from Italy. Their diet is just so healthy and unbelievably good that all the things that we've learned over the last 20 or 30 years as medical science and the healthcare industry are things they were already doing anyway. And for those of you on the podcast who probably know what I'm talking about, the Mediterranean diet,
yes.
right? It's a diet that's rich in omega-3 fatty acids, fish like salmon, nuts, fruits, vegetables, and very, very light in things like saturated fats and sugar. He used to be a barber when he was working. Now he's 83. He's retired for several years. But in Italy, he used to be a soccer player when he was a young man. And as he got older, he realized he can't run like that anymore. It was too hard on his knees and his hips and his joints. But he walked. And so his barber shop in Boston was about 5 miles from his home. So every morning he would walk to the barber shop 5 miles and then work there all
Wow.
day cutting hair and then walk back another 5 miles a day. And he did this for 35 years. Today, my father-in-law is 83. He's not on a single medication. He doesn't have a single chronic medical condition. His only vice is maybe a block of cheese once in a while, especially if it's imported from Italy, some wine.
Yeah.
But in total, he's in excellent health. And it just makes you realize he's not somebody that had access to all this nutritional information and, gyms where he could go lift weights and things like that. He was just walking. And he made it a consistent part of his life and just his daily regimen. And even today, when it's the wintertime in Boston, he has a treadmill in his garage and he's walking on that for 40 to 50 minutes in the morning on an incline. So, we do a cardiac stress test for, the cardiologist office. He's naturally doing that just as part of his daily routine.
Yes.
He's putting strain on his body and his heart. And that's just wonderful. So, I love the idea of just incorporating all of these different things to keep people healthier. Medications are not the only answer. Healthy lifestyle and healthy eating habits, exercise, it just become increasingly important as we get older. So to your point, David, the sooner you get children to adopt those habits when they're younger, exercise that they like, healthy foods that they like, it just sets them up for a very healthy life moving forward into young adulthood and beyond. So
I agree. It's the more and more I talk to people like yourself, what I realize is it doesn't have to be complicated.
That's right.
We're both drinking water. Move your body, wash your hands, and that's an answer I've gotten often is I wash my hands a lot, and and I just since COVID, I think that's more and more a part of our routine. But it's the simple things and those healthy habits that can really set you up for success. So I appreciate you sharing a little bit about yourself, and that can be a private question sometimes. So thanks for the openness.
My pleasure. My pleasure.
And let's get into healthcare a little bit and the insurance side of things, the payer, call it whatever you want. These plans. um, maybe we start with something that's in the news. What we see in the news sometimes is, especially recently, are the challenges that these providers are going through in terms of operating margin, and these rural facilities are having a hard time keeping their doors open because of a lot of things, staffing shortages and margin. That's always the consistent one there. I'm a big believer that it's going to take a little bit from everybody to solve some of these challenges and provide a healthier version of the industry overall. Tell us just at a high level how plans, insurance companies, payers like Anthem are partnering and being an ally with the provider during this time, especially since COVID and ever since.
Absolutely. So there's several ways, but let's start with this, just laying the background behind what our industry is experiencing and how this affects you as patients and we as health insurers and then the broader provider community. So unless you've been living under a rock, you understand that our economy is experiencing some challenges right now.
Yeah.
Inflation is a consideration. Recession is something that people are putting out there as a potential thing that's happening. And that hasn't just affected other industries, it's also affecting healthcare. So the minimum wage for healthcare workers, even medical assistants in a state like California, for example, is $25 an hour. That's something that was proposed in their state legislature and something that will likely be approved. So when you think about who actually pays that cost, it's all of us.
Right.
You have to attract and retain healthcare workers and pay them more. And then what happens is that they're working at a hospital or a health system or a doctor's office. That doctor's office or that hospital system has to negotiate higher rates of reimbursement from health insurance companies just to stay open and stay in business. That pushes that cost to either the government or pushes that to the private sector in terms of the employers that are paying those costs for healthcare coverage for their workforce. The vast majority of people in the United States have health insurance and medical and specialty benefits through their employer. And so when the employers are having to deal and contend with the recession and inflation and increased costs from health insurers and providers, then ultimately they're compressed in two different ways because their profits are compressed because of inflation and cost of goods for whatever product or service they have. And on the healthcare side, healthcare costs continue to escalate. So what can mitigate this or what can control this? From a health insurance standpoint, one of the things Anthem does and believes is a core part of its strategic framework is partnering with healthcare providers across the United States. We're opposed to buying chains of clinics like many of our competitors do. We don't acquire medical practices. We're not trying to control the specialist referral base, which are primary care physicians. We're trying to partner with them, keep them independent, autonomous, and really amplify the reach that they could have to improve clinical outcomes across the country. One of the things that we built is a IT capability called Health OS. And so when you go to the doctor's office, you may notice that he or she is sitting with you, but they're typing information into a software program on their computer. That's the electronic medical record, right? That's your chart. There are no more paper charts. It's all on a computer. So what Anthem decided to do was the best way we can share information, care guidance, alerts with your physician is to send them directly to their electronic medical record. So any information that we have about you, about opportunities to improve your health, we can send it directly to your doctor's EMR. We connect to all the major ones like Epic and Cerner and systems like that. And so maybe you went to an emergency room in another state. Maybe you filled a medication with another healthcare provider. We get all of that data in claims and we bring it directly to the point of care through Health OS and your electronic medical record. And the reason why that's important is because it's impossible and it's really unrealistic to expect a patient to remember everything that's happening that's relation to them. They're going to a doctor as their quarterback to say, hey, what do we do? How do I take care of myself better, or my family members or my children better? Your healthcare provider, armed with data and information and analytics, is in a much better position to improve your health and to take care of you and your family than without that. So that's one of the ways that we try to improve care. Ultimately, we believe that improving healthcare is going to lower costs, because the amount and the number of people with uncontrolled chronic medical conditions, with duplicative lab tests and procedures, is going to decrease because of that better coordination of care between payer and provider. So it's very different how we approach this. We don't try to buy medical practices. We're not trying to buy urgent care centers. We have a very different philosophy and approach. Ultimately, we treat our contracted physicians and healthcare partners as partners. We don't treat them as employees.
I appreciate you sharing that. And it kind of you're touching on a couple things here. One of which is, our personal behavior that could help prevent some of these things, which leads me to, preventative care. But before we get there, one of the big things that you touched on is just the overall innovation in the healthcare space. I had somebody on recently who called this the golden era, or the golden age of innovation for healthcare. There's this negative perception that healthcare is 10 years behind every other industry in terms of innovation and technology. I don't think it's quite that bad anymore. and if it is behind other industries, there's pretty good reasons for it. The data is pretty important, and so security is going to be a priority most of the time. But with that said, the innovation that we're seeing in healthcare is pretty incredible. And one of those things is just the data sharing and access to organized and quality data about the patient's family, comparing that information to the wider demographic and population, and then helping preventatively suggest the right path of care, the right coordination of care. And the healthcare system is really one of the few places that a person is willing to accept guidance, because we understand that the doctor knows more than we do, but the doctor's under extreme pressure to be accurate and to be right. And so I'd like to get your take on the innovation in healthcare and how we're leveraging data now through these different systems and different innovations and interoperability to bring it all together, and how that's empowering the healthcare professionals to provide that preventative care, provide greater access, and all of the things that lead to improved outcomes.
Sure. So just to unpack your question a little bit, because there's a lot there.
Yeah.
But it's a great question. First, data and information is asymmetric. So let's take me as an example. When I go to my primary care doctor's office, they see that, this person has, let's pick high blood pressure as a medical condition and should be on this medication. But I don't know that I'm overdue for a medication. I don't know that this is something I need to take at some, cadence or interval. I also don't know what other preventive studies I may be due for at my age or with my health status. So we have to have a way, by lieu of technology, to be able to connect to that health plan member, that patient. Beyond that, when I call my health insurer, they need to be able to see that information and make it actionable and make recommendations to me. So that information asymmetry has two places that we have to bridge. The third place it has to bridge is with the actual healthcare provider. So your primary care physician has 5,000 patients in their panel. It is very difficult to know every single gap in care or overdue element of care that each of their patients has. So there has to be some way to communicate that to them. So here's how we have approached this as a company at Anthem, and how it's working. So number one, if I call up Anthem, we have these member advocates called Anthem Health Guides, and they're like concierge member service ninjas, basically. They don't just answer your questions about medical insurance or dental or vision insurance you may have. They're seeing on their very involved desktop of information, 3, 4 different computer screens, all the care that you're overdue for, any medications you may be due for a refill for, any program or service that's available to you through your employer that you may be unaware of, anything your family members are due for in terms of care. So that way, when you call them or you're clicking to chat with them through our mobile app, which we call Sydney, they can address your needs as well as all your family member needs in one interaction. So I have children, you have children. One of the things that I called Anthem Health Guide for the other day was I had a question about a claim. And while I was on the phone with them, they said, hey, do you know that your daughter is overdue for a dental visit and she should go now? And we found out that her dentist had left the state of Florida where we live. And so our Anthem Health Guide helped us to find a new dentist, schedule the appointment for us, and sent all of her clinical records with our permission there to make the visit smoother and more efficient. That's the type of concierge level of service you might expect at a hotel.
Yeah.
But we need that for healthcare because healthcare is complex. It's difficult to navigate sometimes. And we need somebody to help us figure out what do we need? What do our family members need? Now help me to do that. That's done by providing data to these different individuals that can help us and bridging that information or data asymmetry that exists. On my phone, and any Anthem member can get this, there's an app called Sydney. Anthem Sydney is the digital app that has all of my health insurance benefits in it. So I have medical, dental, and vision benefits through Anthem. It shows me all my claims in there. It shows me any personalized care gap notifications I may have for myself. It shows me how I can access education, care guidance, resources, things that my doctor might not have time to share with me in his or her office. But I have all that accessible to me in the palm of my hands on a free app that my health insurance provides me with. But most importantly, perhaps, is bridging the asymmetry for our healthcare providers.
Yeah.
Because it's one thing for me to know what care I'm due for. It's one thing for the member advocate at my health insurer to know what I need. But the person who's responsible for my health is my doctor.
Yeah.
And so if we don't communicate this data and information to our healthcare providers, they can't take action on it. So our company, Anthem, has really made a very heavy investment in helping to provide the data, the analytics, the care information to our healthcare provider networks that are relevant for each patient. And that's the capability I talked about a little bit earlier called Health OS. But I'll also say is that in medical school, many of us as physicians, we don't learn about the specific needs of every community. It's impossible. The medical school is only 4 years and residency is 3 to 5 years after that. But the needs of the African-American community, the Hispanic and Latino community, the LGBTQ community, they have very different health risks and needs. And so we created a website called mydiversepatients.com that's entirely free to every healthcare provider in the United States, whether you're a contracted provider with Anthem or not. And it's basically free education to get people more familiar with what are the needs of these different communities, what are cultural considerations we should have as healthcare providers, and geographically even. There are differences in patients in different parts of the country. What are things to be aware of that could impact people's health outcomes? We put that all out there for the provider network. So it's not just how we share data with them. We educate our healthcare provider network. We truly are partners. And it's because we are physicians as well that we know what the gaps are. So we try to bridge those gaps.
And social determinants of health are just another element, another variable that could throw a wrench in this coordination.
100%. You know, there's a tool we have accessible through Blue Cross Blue Shields Association called CHM Hub. And what it is you go into this IT tool and you see a map of the United States. And I could click on Dallas, Texas, and I could zoom into your zip code and I could see everything known about that geography from a social driver of health standpoint based on 50 to 100 different data sets that we use. So I might be able to zoom in and see you live in a transportation desert, or there's a breast imaging facility shortage in your geography, or there's a primary care access issue. And when you're talking with us at Anthem, we can because we see that before we even talk to you, and we know this about where you live, we can offer you things, capabilities, services that, in recognition of where you live, we want to make sure that you have the best health possible. Maybe you need transportation. Maybe you need, virtual care access. There's different things we can offer. So social drivers of health, we consume a tremendous amount of data, but what we really try to do is turn those pieces of data into actionable insights. What we eat, where we live, it affects our health. And so knowing that about each of our members really helps us to guide them, improve their health, and ultimately overcome those things that serve as barriers to having better health.
The virtual health side of things, telehealth, what we became so familiar with during COVID. We saw the positive effects that it had on the patient community, but also the healthcare provider community, because in some ways it opened some bandwidth for the providers that are always stressed with staffing challenges. Do you see, and I know this is a terrible challenge, but no margin, no mission. Do you see telehealth and virtual health becoming a long-term viable solution for providers? And by that, I'm really asking, is the reimbursement, those fee structures, those payment schedules, those payment structures, are they here to stay? What the doctors were able to leverage, the providers were able to leverage during the COVID era, and still get reimbursed at the level that they needed. Is that here to stay, in your opinion, to provide access to the people that are in some of these tough to reach rural areas?
Yeah, that's a great question. So what I would say is the COVID pandemic forced our entire healthcare delivery system to shift to virtual care delivery almost in the blink of an eye, overnight, just to maintain access to care for all Americans. Since the public health emergency has ended, what we have seen is a shift in utilization in our book of business for virtual care services. So what it seems like has happened is medical services that would have otherwise replaced the brick and mortar visits to physicians, they have kind of returned to pre-pandemic levels. They don't represent a shift in preference or shift in utilization pattern in the aggregate. I do think that in certain rural or remote areas, virtual care delivery is here to stay, and it's something that really helps to bridge gaps in access to care. But in terms of behavioral health, I think that's an entirely different scenario. So what people were forced to do during the pandemic is use virtual care delivery to access behavioral health care services. What people realized was, for sensitive and difficult to talk about behavioral health conditions, virtual care delivery from the privacy and comfort of your own home was the actual preference, not just during the pandemic, but way beyond that as well. So in our book of business, in our data, what we seem to see is a sustained and elevated utilization of virtual care services for people with behavioral health needs. So I think that given the nature of that type of clinical interaction, it's primarily verbal, right? There's not a physical exam necessary that's required. It really is a potential viable long-term solution to bridge access barriers, shortage in supply of behavioral health clinicians. I don't feel the same way necessarily about medical care, because there are just certain things that you can't do with virtual care. So it has its limitations from a medical standpoint, but from a behavioral health standpoint, what's the difference if you're sitting in the same room as your healthcare provider or at your home and you're having the same interaction and the treatment is the same? It even increases the frequency that you could have interactions with that behavioral health provider. So I don't have the exact answers to what's going to happen in terms of reimbursement in the future, but I do think that these are two distinct scenarios, medical versus behavioral health. The consumption and preference for how to utilize care is different, so the reimbursement will likely need to be different as well.
Yeah, that makes sense. We had a really young, baby at the time during the pandemic, and having access to, that virtual health or telehealth visit in the middle of the night, or when you were a little worried to go into a waiting room and sit around with a fragile newborn. But those are sometimes the exception to
That's true.
to the overall preferential, the overall preference of the patient population.
I'll tell you.
Go ahead.
To your point, during the pandemic, in my full-time role at Anthem, I'm not directly patient-facing, but I am board certified in pediatrics, and that's my specialty. And I am licensed in multiple states. So I did sign up to be a telehealth physician during the pandemic, primarily because I wanted to help families with young children avoid the emergency room. You might recall, even when the vaccine was first rolled out for COVID, it was available only to adults, not children.
Right.
And so adults, understandably, I'm a parent, you're a parent, we felt apprehensive about bringing our children into a healthcare setting where they are defenseless. And so I felt that by taking care of patients to whatever extent I could as a telehealth pediatrician, if it could help them avoid the emergency room, at a minimum, that's what I wanted to do. So I would turn on my computer at nights and weekends after 5 p.m. because when I was done with my regular job, I would have dinner at home. We were all isolated to our homes. And then my online waiting room would start filling up. On average, every night for 4 or 5 hours, I would see about 30 to 40 patients. So when I think about that, that's 30 to 40 families that I helped avoid being in harm's way in an emergency room when there was no vaccine for children. So that makes me feel good. And as a result of that, I still make myself available to see patients a few hours every month on that platform. I think the demand has decreased, but nights and weekends, summer vacations, things like that, where it might be difficult to get an appointment at your primary pediatrician's office, you could see me. And on these platforms, you could prescribe medications. There's a lot that you could diagnose just visually. You don't necessarily need to lay a stethoscope on someone's chest for that. But yeah, telehealth during the pandemic definitely changed people's access to care. And my patients were very appreciative. I was humbled to be able to serve them. And it's just something that I thought physicians have a responsibility to make themselves available during public health emergencies like that. What's, I think, good about the telehealth platforms that were out there, so through American Well or Teladoc or any of these popular ones you hear about, different states loosened up their licensure requirements. So I'm licensed in Massachusetts and in Florida, but I was seeing patients from Wisconsin, Texas, Ohio, California. They just said, if you're a board certified physician in that specialty, you could see patients from anywhere. And I thought that's probably what they should do for the longer term, but it hasn't happened yet.
The pandemic really was a great example of everybody within the village coming together for, the improved, all the things that we talk about, access, experience, outcomes. The other thing that really helped a lot of families, not just avoiding the ER, but it, obviously got them the care that they needed, but it also helped financially too. You walk in, young family, you walk into the ER, you know what to expect a couple weeks later. And it's stressful, but at least having an avenue to a professional that might cost less, lower barrier of entry. And then if you needed to escalate care or elevate care, you had that opportunity shortly after. And so, especially in a rural community, I live about 70 miles outside of Dallas. The closest critical access hospital to us is about 40 miles away. And so, that's an important element to providing access to all kinds of communities. That's just one example. So I appreciate you sharing that information there. Something else that I'm hoping you could clear up for me, and this will be the last question because we've covered a lot. The value-based care model, it goes hand in hand with this preventative care conversation, but it's a little bit of an enigma to me. I've been in healthcare the last 11 years. We've been talking about it for about the last 11 years. What do you see in terms of implementation, adoption, and then evolution of the value-based care model, if we're looking five years down the road or so?
Yeah. So for listeners on the podcast less familiar with how to think about value-based care, the simplest example of it is this. If I have a sore throat and I go to a fee-for-service traditional physician's office, they're going to take care of my sore throat, maybe prescribe me an antibiotic, and I'm on my way. But if I have a sore throat and I go to a value-based care provider's office, they're going to take care of my sore throat in the time of my appointment, but they're also going to check, am I overdue for medication refill? Am I overdue for colon cancer screening? Do I have some other concern that I want to talk to them about? They may spend more time with me during that visit, but they're going to address all of my healthcare needs at that one interaction. That's going to keep me healthier for the long term. The goal of value-based healthcare is to keep people healthier. And the fee-for-service model is broken in our country. What's challenging from a value-based healthcare standpoint is multiple. Number one, in medical school, this may shock all of you to know, but we didn't get much education in value-based healthcare. It was not as well known or popular at the time. And I'm a younger physician. I didn't learn about this in the early 2000s when I was in medical school or residency. I was in contact with some medical schools recently, and they don't have the slightest idea about how to teach about value-based healthcare, where to start. There's so much that you need to know as a healthcare provider or anybody in value-based healthcare that's impossible to teach during those years. An example would be claims analytics, predictive risk modeling, evidence-based healthcare, STARS quality measure. These are just foreign terms to academic physicians, but it's so important for value-based care. So one of the things Anthem did with me is we started a webinar series for all healthcare providers called VBC 101, Value-Based Care 101. And in that series, it's free, we teach the fundamentals of value-based care, things that you don't learn in medical school. What are bundled payments? What are care coordination, patient-centered medical homes? What are the different ways you can configure your medical practice to actually operate and take care of patients in a value-based care way? I think this is a very slow, difficult process to move our whole country's healthcare delivery system toward. I do think the government is helping. They're trying to push fee-for-service providers to do things such as reporting quality metrics and outcomes for their patient panels. They're really trying to incentivize participation in value-based care arrangements. And we're doing the same thing on the Anthem side. So I think that from a value-based care perspective, it's better care for patients. It's what our country needs to move toward. It is very challenging and difficult because it involves very early on, education has to change to reflect what our healthcare delivery system needs to produce. And physicians, their healthcare teams, allied health professionals, they need to be trained and educated on how to be successful in these type of contractual arrangements. It is a very involved and complicated process, and it's a slow process. So it's something that needs to continue and move forward. But I don't want to mislead the Highway to Health listeners. It's going to take some time.
Yeah, it is. And for all the reasons you mentioned, but what gives me hope, and I think it gives the entire community hope, is, if there's one way that the patients, the providers, and the payers are aligned, it's this idea of keeping the population healthier longer and avoiding these big episodes of care. Obviously, that's obvious for the patient. For those that aren't in healthcare, it's probably not obvious why that's beneficial for the provider or the payer, because you might see a big bill come in the mail and go, yeah, of course they're going to charge me this amount because they need their money. In reality, those big episodes of care put a lot of stress on the system and cost a lot of money for the providers and the payers to coordinate and deliver on. And so what gives me hope about this preventative care trend and the value-based care model is it's leveraging that true alignment that all three of these communities have: the patient, the provider, and the payer. And that's exciting, because financially, personally, I want to stay as healthy as I can for as long as I can. But it's also beneficial in a lot of ways, actually, for the provider and the payer along the way too.
100% agree. This is not just for patients, it's beneficial for providers. There are healthcare providers that are in value-based care arrangements where there's downside risk, or they're in arrangements where there's both upside and downside risk, and they do very well financially. The reason is they're achieving certain bonuses for achieving certain quality targets with regards to their clinical care. An example would be, if readmission rate certainly is one measure, but then other measures that are simple too, like do 90+% of your eligible female patients have a mammogram ordered for timely breast cancer screening? If you don't have a primary care physician, that rate is going to be low. If you do, we try to incentivize physicians and their clinical care teams to achieve these quality of care targets, because we know that there's a direct tie to, for example, early breast cancer diagnosis and saving someone's life, but also avoiding unnecessary healthcare cost. And so that is just one example of how contracts are constructed for value-based care. It helps patients, it helps providers, and it helps the entire system, as you exactly said.
I appreciate being on the show today.
It was my honor. It's an absolute pleasure. Hopefully I get invited back sometime in the future. But this has just been such a great experience, and really I'm a big fan of the podcast, and thank you.
Well, thank you, and good luck to everybody.
Thanks. Thank you, everybody.